Who else do we have? We have Dean on, Dean Backer, yourself,
I'm here.
Marianne.
Yeah,
Yes.
Jamie. And Jamie?
We have Jamie. And
That's it.
I think that's
Tanya.
it.
Mhm.
Oh,
Tanya's here.
oh, Tanya's
Sorry.
here. Okay. And Tanya's here. Okay.
Okay, so then we have Dean Backer, Blair Flowers, Nancy Jacko, Jamie McCarvey, Dan Ravita, Marianne Strickland, and Tanya in attendance. Perfect. Okay, thank you very much. So, approval of the agenda. Is there any addition of new agenda items? No, if there's not any. Moved by Marianne Strickland, seconded by Jamie McCarvey. Be it resolved that the Finance and Property Committee agenda dated June 22nd, 2022 be approved as presented. Approved? May I have, if I can't see the hand, so if anybody does not approve it, put your hand up. Okay, so that's been accepted, carried. Carried. I guess what I have to do is the vote to vote on it, the recorded vote for circulation, yes or no. Dean Backer,
Yes.
Blair Flowers,
The Michael.
Yes.
Nancy Jacko,
Yes.
Jamie McCarvey,
Yes.
myself, yeah, Marianne Strickland, and Tanya Verbosch.
Yes.
Thank you very much. We have a conflict of interest declaration. I don't see anybody saying anything, so I guess we can move forward. Approval of the previous minutes. It's moved by Nancy Jacko, seconded by Marianne Strickland. Be it resolved that the minutes from the Finance and Property Committee meeting held on April 22nd, 2022 be approved as presented. Any comments? Questions? No? So we'll proceed to the vote. Dean Backer,
Approved.
Blair,
Yes.
Nancy Jacko,
Yes.
Jamie,
Yes.
myself, Marianne,
Yes.
and Tanya Verbosch.
Yes.
So that's been approved. Finance and Property Committee in camera minutes, April 22nd. It's moved by Jamie McCarvey, seconded by Nancy Jacko. Be it resolved that the minutes from the Finance and Property Committee in camera meeting held on April 22nd, 2022 be approved as presented. Dean,
Yes.
Blair,
Yes.
Nancy,
Yes.
Jamie.
Yes.
Yes for myself, Marianne,
Yes.
Good.
and Tanya.
Yes.
Perfect.
Yes.
Thank you very much. Moving on more
Thank you.
forward, the next meeting will be September 28th, 2022. Time is to be determined. Location is going to be determined. Business arrived from the last meeting. There isn't any. The new business, we have 7.1, 7.2, 7.3, and they're basically they're the first quarter financial statements, first quarter medical officer of health expenses, and the reconciled budget and risk management assessment. So it's moved by Nancy and seconded by Marianne, whereas the North Bay Parry Sound Health increased funding for 2022 from the Ministry of Health, and whereas the Board of Health must approve all funding from the ministry in order to receive the transfer payments, and whereas amendments to the previously approved funding affect the total shareable base, and whereas the following three options were provided for consideration. One, that the excess 2022 municipal levy be reduced by 79,836 prorated by population. That the excess 2022 municipal levy be deposited to the municipal reserve, or that the excess 2022 municipal levy be used to fund 2022 costs at 100% for the adult dental program to reduce the wait list. Therefore, be it resolved that the Finance and Property Committee recommends that the Board of Health for the North Bay Parry Sound District Health Unit approve the reconciled 2022 Board of Health budget and the expenses for $26,010,017. And furthermore, be it resolved that the Finance and Property Committee recommends that the Board of Health proceed with the option 1, 2, or 3. So, can you speak to this? I guess it'll be Elizabeth. No, it'll be, sorry. Isabel. Yeah.
Yes, so this year it's more complicated than usual. I would say probably this is the most complicated budget approval that we've gotten in maybe the 15 years I've worked here. We got a lot less money than the Board of Health approved. So my task was to reduce the budget down to the amount that the ministry had approved. So I did that, but I have to give fair warning that you can tell from the document that there are a number of costs that now this year will have to be funded from unexpended dollars related to unfilled positions. Such basic things as the maternity leave budget have been removed from the budget, and some of our legal fees budget has been removed. And anyway, I provided the whole list. I tried where I could to shuffle money, like the needle exchange money, which they funded at 100%. So I took it out of the cost shared budget and I substituted it with 100% funding. So I did that where I could, and that $266,000, a lot of it is recurring money. So when it comes to make next year's budget, that all that money will end up in the budget again, and I guess we'll try again to see if the ministry is going to increase anything. It does mean that the shareable base went down by that 266,000 essentially. So that's where the municipal reserve options come from. This is the 30%. Well, that's another one of the complications in this whole thing. But the new 0.75% that we got, there was no matching mitigation funding for that. So that makes a bit of a difference in the whole total. But anyway, in the end, there's $79,836 of money that we levied that doesn't match provincial dollars. So these are the options that I could think of that I thought were appropriate. As management, I think because we're having struggles with adult dental, I've put forward after consulting with Shannon and with the program as to whether the money could be used or not, that they felt that they could use this money before the end of the year to really help some adults. We have a very long wait list for adult dental. So I think I'll stop there and then I'll answer any questions that anybody might have, because I know it's quite complicated.
So I guess, okay, I'll open the floor. Questions, comments?
I was gonna say, it's Tanya, I have a question.
Shoot, Tanya.
So, just a couple of them. So we saw less money because population decline in the district? Is that?
No, the ministry, this is to do with the ministry's funding. So we approved a budget that was, I'm going to say 2.33% increase over the prior year. Yes. And in the end, the ministry gave us 0.75%.
Oh. Sorry, I don't think I was expecting that, because I think our budget was the one that was really, I'm trying to think of, there was a lot of risk, right? But didn't we think that, I think what each municipality had budgeted, I know the city, I think, kind of went middle of the road. But I don't think, is this going to really impact the municipalities at all, or we're just going to try to absorb it?
Well, we're trying to absorb it and use essentially money that won't get spent because, like, we have unfilled positions and things like that. So we're going to balance the budget with that for now. Next year it's a whole other story that we don't know about, and we don't know about mitigation funding. If it all goes away, then like the whole story is quite different. So yeah.
I was going to say, so what you're saying though is after what we've gone through with COVID and public health, being the heroes that we've always touted them to be, we got 0.75%.
Yeah, they and if you read it in the media somewhere, it'll say we got 1%, but they started at 3/4 of the way through the year. So we got funding that normally starts at January 1st, and they started at April 1st. So realistically, we got 3/4 of 1%. It was 100 shared. This is after sharing, and you put in your the municipalities put in their contribution. The amount of the increase is $122,000.
Okay. I think on a bigger scale, I think I'd like to have the conversation about how municipalities can maybe advocate or make this a bigger issue, because I think that that's very sad with everything that we're doing and the struggles that we're having. The other question I had was more in line of the adult dental. And I wasn't sure to ask it here or ask it later on, but I'll ask it here. How do we plan to use this money? Like, what are the measures that we're going to do to reduce the wait list? I know I spoke with a dentist over the last month or so, and they were saying that are we using outside dentists to help offset that wait list?
Yeah, that's the proposal with this money. Previously, we didn't really have any budget for going outside of the of our own capacity within the dentists and staff that, RDH and CDAs that we have. But the clinics are quite full. So in-house, we really have no more capacity. So this would actually give them some money to go outside to get some specialist work done, to get some, even just contracting other dentists in the community. We're looking at the present thing that we're looking at is taking, we contracted with a number of dentists to do seniors dental care, and we have a rate that we're paying for that. So we're looking at maybe offering that same rate to dentists to do adult dental and see if we can get some buy-in with that. Part of the issue we're having right now is the OW and ODSP rate. Most dentists won't work for that rate. So, so we have people that are refused all over the place. So, so offering that rate is not likely to get us any outside help, but if we can come up with a bit more money, then we're hoping that we can get some people seen. I mean, 79,000 when it comes to dental work doesn't go very far, but it goes farther than nothing.
Exactly. No, I appreciate the response. I look forward to seeing how that turns out.
Is there any other questions or comments?
I had just, it's Nancy, excuse me, I had gotten an email from Scott Robertson. He was not able to attend tonight, but he just wanted me to pass on that he supported using the excess municipal levy to reduce the wait list for adult dental program.
Thank
So I'm
you.
expressing his wish.
Any other comments, questions?
Mr. Chair, it's Dean.
Hello, Dean.
Hi, Mr. Chair. Can you hear
Go
me?
ahead.
Okay, yes,
Yes.
no, I'm okay. I represent a few municipalities, and I kind of ran it by some of them. You know what? The municipalities are already been levied. It's, you know, our budget's already set, and I have no issues of reallocating those dollars elsewhere.
Great. Thank you. Marianne? Yes,
No, just
Marianne.
to pick up a little bit on Tanya's point, and if Isabel has any suggestions, as you know, a new cabinet will be sworn in the not too distant future. If there's anything that we can do as the municipalities to leverage a little bit more funding for the health unit, that would be, you know, now it would be, we should be doing it now rather than waiting until later to get it on everybody's radar. And I also agree with the adult dental. Just don't forget us down here in the southern part of the district, where it's very poor here. And as you know, a lot of the seniors here can't afford to pay the dental rates either. So don't forget about us.
No, I think we're thinking of, when we're talking about this money, it's for the group of people between 18 years of age and 65, because the Ontario Senior Dental Program is available to those over 65. And we did get a really decent increase in the seniors dental budget. They did prorate it as well, but I asked for the moon and they did approve the moon. So we will actually, hopefully, you know, that will start next year, the full amount. So we should do better. But some of it is you know, finding the dentists that are willing to work for what we've got to pay. So we're, but that's a constant process, and we've been building up the supply of dentists gradually in the last 18 months, and we're getting there.
Thank you.
Thank you. Any other comments?
I think Jamie has
So,
one.
okay, Jamie, go ahead.
Sure. So, yeah, I think I could certainly support the dental program on that. And the comment was made about, you know, the budgets are already been set by the municipalities, so we may as well move along with that. There's try to help where we can. With regard to the comment about how do we advocate for this, well, I think we need to work through Phenom and NOMA and AMO and get a resolution off to them, basically asking for their support to advocate for more funding for health units. You know, and the uncertainty that this is causing, you know, it has created an anxiety within the health units that, you know, is given. You could preface it by saying, given how health units, you know, stepped up and really did a wonderful job through COVID and all of the excess work that they had to do, you know, the government should be stepping up with more funding for health units to offset, you know, the municipal cost, because really healthcare is a responsibility of the province, not municipalities. And so they should be paying more than the lion's share, because every time there is a reduction in cost from the province, it's a download really to the municipalities directly. So we need to get that advocacy out there and make sure that we're covering the front page of this. Yeah.
I agree. I
Excellent.
think AMO is probably the best place to put your requests.
Now,
They
Jamie,
seem,
thank you, Isabel. Is there any substance to having a delegation through one of the organizations at the AMO in regards to this statement that you just made? Is there somebody that we can approach to do a delegation? Because we know AMO is coming up. We know we're going to have a new minister for sure. Perhaps if I don't know who could take it on our behalf. What is your suggestion there, Jamie?
Well, okay, so if you want to make a delegation, let's say to the Ministry of Health, okay, which would be the right thing to do, do they not, I'm just trying to think, you could work through a municipality, okay, if you wanted to. Maybe the city of North Bay could make a request or whatever for a delegation to the Ministry of Health, and then we could all show up, for the meeting. The other avenue is to just get a hold of Monica Turner, okay, because I know Monica's quite an advocate for public health, and just ask her the best approach, okay, and it should come from Dr. Chirico, which he knows Monica anyway. So I think they went to school together. So that would be an avenue to start with, so that and Monica could provide you then the direction of how to get a delegation, whatever, if it's coming from public health. And those of us that will be attending, okay, if we know the time and place or whatever where it's going to be, then we can show up and, I'm sure staff can come up with a script that can be put forward so that someone can, do the ask. Does that make sense?
Makes a lot of sense. So perhaps what we could do is we'll finish off with the issue of the motion that's on the table. What I see is that there's a consensus regarding that we do use option 3. And I guess what you're saying, Isabel, this is the best option to make sure that we don't leave any money on the table. Because
Yes.
if we leave money on the table, it goes back to the ministry. So we don't want to do that.
yeah, we don't want to
So-
do that. And this is nice and clean for my purpose. I can transfer the money directly there. And if it doesn't get spent on adult dental, it will end up in the reserve at the end of the year through the usual process anyway. So, but in the meantime, if the more of it we can get spent, then more people get helped. So,
Okay, so we landed more or less on the option number 3. That seems to be the consensus. So we'll vote on it, and then I'll deviate from the agenda, and we can talk about the proposed what Jamie basically explained to us on the process of having a delegation. So the recorded vote for circulation for option 3 and I won't reread the whole thing. Dean, you're in accordance?
In favor.
Blair,
Yes.
Nancy,
Yes.
Jamie McCarthy,
Yes.
myself, and then Marianne Strickland
Yes.
and Tanya Verbosch.
Yes.
So I know that I've been accused at my council table of deviating or trying to deviate from agendas. And it's procedurally not warranted. However, I think this is important enough that we do have a small discussion if you people will permit me to just open up the table and basically provide direction to Dr. Chirico on the suggestion that Jamie provided us, in as much as that he does talk to Monica Turner and ask her the best approach to, to basically plead on our case for, the fact that the finances that we got were not adequate, and that, we're looking for their support to provide more money in the event that there is available money in the near future. Is that a doable? And now I'm directing it to Dr. Chirico.
Yes, that would be fine. I can move that forward and see where we end up. I think that you're absolutely right that the municipalities have much more leverage with the government than certainly the voice solely from public health. We've tried that in the past repeatedly, and it's only really when the municipalities get involved that we actually see that there may be some potential for change. And I think that it's also significant in that next year, if that mitigation funding is not provided and it remains the way it was pre-COVID, you're looking at almost a 54% increase to municipalities for public health funding.
So great. So,
And Chair, it's Tanya. I was just going to say that in the discussions, if you need a municipality to put the delegation forward, I'd be more than happy to do it through the city.
well, thank you for suggesting that, Tanya. But I think Jamie was basically suggesting that we go to Monica first and find out if that is the proper approach, and if she
I was
thinks
just saying that if you needed a municipality after you spoke with her.
Excellent. Thank you very much. So, Jim, Dr. Chirico, I guess we've provided you with some direction, and hopefully we can come to a conclusion on this, because it's going to be, like you say, next year, if we don't get that funding, the municipalities, like Jamie said, are going to be, it'll be downloaded on us, and it'll be kind of, our levies will go crazy, and the public won't be too happy with that. Jamie?
I was just going to conclude by saying, right now municipalities contribute to to healthcare $3 billion a year, and that's directly from the municipal tax levy right to the government to offset healthcare costs. When, like I said earlier, healthcare costs are really a responsibility of the province, not the municipalities. They've done this with housing, and now more with healthcare. We're worried that, the paramedicine program, we really like, because it gets in there and allows people to be taken care of and responded to before they end up in the hospital, which is saving a lot of hospital time and money. And, I'm sure they're saving millions more than what it's costing them to run this program. But our fear is that they're going to turn around and they're going to download portions of that as well. So we need to make sure, we put a firm message to the government that this is a direct download if we don't get proper funding that public health units need. So that needs to be part of that messaging.
Thank you for sharing your wisdom on that, and I guess we'll just move forward. Dr. Chirico has his directions from the board. Hopefully we can put a delegation together through, if Tanya's saying the city of North Bay is willing to do it, then we do it that way. If Tanya thinks that's the proper method. And then that way we can at least be heard at the table, and then if Minister Clark, the rumor mill, says that might be appointed Minister of Health on Friday, if that's the case, at least we'll have not a colleague, but somebody that understands municipal government. So, note in camera, and now it's the adjournment of the meeting. So, presently at
There was another.
Sorry?
There's another
Is it-
briefing note on the agenda. I don't know if anybody has any questions about it.
Oh, you mean the risk of management?
Yes.
Oh, sorry. I got going on another train of thought. Is
Yeah,
there any
there's-
question? Sorry about that, Isabel.
No, it's okay.
You're keeping me straight. Thank you. Is there anybody that has any comments or would like Isabel to go through the risk of management assessment, or is everybody comfortable with the briefing note? It seems everybody seems to be okay with it.
That's good. I just have to, it has to be documented that you reviewed it, so.
Okay. Thank you for keeping me on stream. In camera 8.0, we have nothing. The adjournment, so it's presently 5:35, meeting Finance and Property Committee of the Board of Health is finished. Thank you, everybody, for your attention. Good discussion. And now I pass over the rest of the meeting to Nancy, chairperson. Thank you, Nancy.
Okay, thank you. Good evening, everyone. We'll call to order the Board of Health meeting for June 22nd. First of all, for the approval of the agenda. Did anyone have any additional things that they wanted to add to the agenda before we go through the approval process? Seeing and hearing none, I have a motion that's been duly moved by Marianne Strickland and seconded by Jamie McGarvey. Be it resolved that the Board of Health agenda dated June 22nd, 2022 be approved. And I'm going to call does anybody have any discussion before I call the vote? Okay, I'll call the vote then. Dean Backer?
Yes.
Blair?
Yes.
Nancy, yes. Jamie?
Yes.
And Dan?
Yes.
And Marianne and Marianne?
Yes.
And Tanya?
Yes.
Okay, and so that motion is moved. Okay, carried. Okay, just a reminder, point 3.0, if anyone has a conflict of interest during the meeting regarding any of these topics, please declare it. Hearing none, we'll move on to approval of the previous minutes of the board meeting of May 25th, 2022. I have a resolution here moved by Jamie McGarvey and seconded by Marianne Strickland. Be it resolved that the minutes from the Board of Health meeting held on May 25th, 2022 be approved as presented. Any discussion or any omissions or additions that people want to have before we call the vote? Hearing and seeing none, then I will call the vote. Dean?
In favor.
Okay, Blair?
Yes.
Okay, Nancy, yes. Jamie?
Yes.
Dan?
Yes.
Marianne?
Yes.
And Tanya?
Yes. Yes.
Okay, thank you. Motion is carried. On to item 5.0, date of next meeting, September 28th, 2022, and time and place to be determined. Wow, that's a couple months away. It'll be here before we know it. Was there any business arising, that's item 6.0 from the previous minute that anyone had? Seeing and hearing none, we'll go on to 7.0, report of the medical officer of health. Dr. Churchill, the floor is yours.
Thank you, Nancy. So just in general, again, not much new to report since the last meeting, and general direction as far as the COVID goes is pretty much the same. downward in all of the indices. We continue with vaccinations, although they are certainly minimal at present, but we are planning for the fall. And we don't have any confirmation yet as to which vaccine may be available for those less than 5, as well as a new bivalent. So we're waiting further information on that and planning accordingly. As far as the monkeypox, there are approximately 33 cases in Ontario, mostly in Toronto, and we don't have any in our district. And that is pretty much it, other than we were seeing a significant increase in influenza activity in May, and that has trailed off, thankfully. And last week, there weren't any cases reported. So that's pretty much all I have to report. If anybody has any questions, be happy to take them.
Are there any questions out there for Dr. Chirico? Oh, we're just moving along here.
Hey,
Oh,
Dan.
Oh, I'm sorry, Dan.
Thank you, Madam Chair. Dr. Chirico, it seems that every day I find somebody says that they've got COVID. Even yesterday,
Pardon?
A young man.
Every day. We can't hear you, Dan.
Oh, I was just saying that it seems every day we get somebody saying that they have COVID, and I guess they're doing their self-tests. There's no record of those people, right?
No, what we do know, Dan, is that there's significant transmission of COVID, and I'm pretty sure that everyone in the room and online knows somebody that had COVID. The vaccines weren't great for stopping transmission, especially with everything being open and people carrying on as normal. But what it's really been effective at is keeping people out of hospital, keeping them out of ICU, and reducing deaths. So that's where it really has been very, very helpful. So people are just learning to live with it. Most cases are very mild. They may feel pretty rotten for a short time. There's always the possibility of long COVID, but for the most part, people will recover within 1 to 2 weeks.
Supplemental to that, with all the graduations that are going on in the next couple of weeks, and Kate, well, this particular case was an individual that graduating and they tested positive at home. And the first thing that I said to the individual, I said, well, the father, I said, I hope you're not going to go to the graduation and, get other people sick. And it was like, well, no, I think we're all right. We're going to go anyways. So I don't know, that attitude. Sometimes I didn't make any comments because I didn't want to ruffle enough feathers. So, but it seems that some people are just, oh, man, I got it. I can go where I want to, and I'm not too worried about it, transmitting it to somebody else. It's more of a comment than a kind of question.
I understand.
Thank you.
I think too, what happens is people are kind of getting tired of it, right? And I think they've just worn out, or they don't think that it's that serious anymore, but we know it can still be.
Sure, it's Tanya. I had a question.
Yes?
Dr. Chirico, I was just wondering, are we sort of back to normal now, or would you say that, are all our programs back up and running, or are we still a little bit behind?
Oh, we're trying to catch up, but we're not back to normal as far as our backlog is not caught up by any stretch of the imagination. So we're still continuing to work through COVID with immunizations, but all the other programs, when we started this a while back, where some were running, some weren't, but we were trying to get back to our regular programming as best we could. So yes, we're in transition. but we're certainly not back to our normal work with the normal workloads.
Okay, and then the other question I had was just in regards to staffing. Are we doing okay with having enough staff? Or I know a lot of organizations are seeing whether it's I forget what the terminology is, where people are just leaving to go be happier somewhere else, or there's the shortage when it comes to in the nursing sector. I'm just wondering how we're doing with staffing.
We're doing well with staffing. We are, and one of the things that I instructed HR to do is to keep people on that we had hired sort of casual part-time to give regular staff a break and to get caught up. So we will utilize those as much as we need to and bring them in to certainly help out. And I just want to have a big thanks to all those people that came and helped the health unit throughout the entire COVID 2.5 years that we've been working on it, and it really has made a tremendous, we couldn't have done it without them. So all the volunteers and all the people that are working casually. So we are continuing to utilize their expertise, certainly not at the same level as it has been, but we are certainly cognizant of the fact that the staff are tired, they need a break, and hopefully this summer will be a chance for them to get that much needed respite.
And I really, thanks, Tanya. And I really think from the board, I think we need to, it would be really nice to acknowledge and thank the staff, because the fact that we've kept staff through all that they've gone through over this whole period of time when so many places are losing their staff speaks a lot about the organization, that it stayed intact through so much that it had to go through. So I don't know how we would be able to get that thank you out to the staff.
We've been doing that.
Okay,
Yeah.
Just that the board also supports,
for the board
from the
too.
board to certainly support that.
Yeah,
Because,
we can work that.
okay,
Yeah.
thank you.
Great
We'll do
comments,
that.
Chair.
Okay. Any other questions or comments? Okay, we'll go on to Board Committee Report 8.0. We just previously had our Finance and Property Committee meeting, and there is a motion that has come out of there, moved by Jamie McGarvey and seconded by Marianne Stickland. And it's the one I'm going to, I'm wondering the best way. Well, I might as well go through so people see the options. It's whereas the North Bay Parry Sound District Health Unit received funding for 2022 from the Ministry of Health, and the Board of Health, whereas the Board of Health must approve all funding from the ministry in order to receive the transfer payment, and whereas amendments to previously approved funding affect the total shareable base, and whereas the following three options were provided for consideration. One, that the excess to 2022 municipal levy be reduced to $79,836 prorated by population. Two, that the excess 2022 municipal levy be deposited to the municipal reserve. Or three, that the excess 2022 municipal levy be used to fund 2022 costs at 100% for the adult dental program to reduce the wait list. And therefore be it resolved that on the recommendation of the Finance and Property Committee, that the Board of Health for the North Bay Parry Sound District Health Unit approve the reconciled 2022 Board of Health budget with the net expenses for $26,118,017 dollars. And furthermore, be it resolved on the recommendation of the Finance and Property Committee that the Board of Health proceed with option 3, that being using the dollars to go towards the adult dental health program to reduce the wait list. So I'm going to, is there any discussion or comment before we call the vote? This was decided by the committee prior to this, so I'm going to call the vote on it. Dean?
Approve.
And Blair?
Yes.
Nancy, yes. Jamie?
Yes.
Dan?
Yes.
Marianne?
Yes.
And Tanya?
Yes.
All right, and with that, that motion is approved. carried, I should say. Okay, now we are on to any correspondence, and there was a few things, I think, in your package, if I'm correct on that. Are there any questions regarding any of that? Okay, then on to 10, new business, and we have the meeting schedule, and it has been revised. And the revised piece is, if you see in the red, that the Personnel Policy Employee Labor Relations Committee was removed from tonight's meeting. So with that, all the other dates for the remainder of the year are here and as well as the January meeting are here in our package. So I'm going to just call now therefore be it resolved in accordance with Section 18 of the Board of Health. Oh, I'm sorry. I have a motion, I should say, first moved by Marianne Stickland and seconded by Jamie McGarvey regarding this whole meeting schedule. Now therefore be it resolved that in accordance with the Section 18 of the Board of Health bylaws that the Board of Health for the North Bay Parry Sound District Health Unit approve revisions to the 2022 Board of Health meeting schedule as presented. Is there any discussion regarding that? Okay, I'll call the vote then. Dean?
Yes.
Blair?
Yes.
Nancy, yes. Jamie?
Yes.
Dan?
Yes, madam.
And Marianne?
Yes.
And Tanya?
Yes.
Thank you. And with that, that motion is carried. Okay. Now, we have a motion to move into camera. That's number 11 on our agenda. So I have a motion here, moved by Jamie McGarvey and seconded by Marianne Stickland. Be it resolved that the Board of Health move in camera at 5:51 p.m. to discuss item number 11.1, labor relations or employee negotiations. I'm going to call a vote on that. I'll go through the names. Blair?
Yes.
Oh, Dean, I forgot you. Dean?
That's fine. Will you have quorum? I apologize. I have another meeting. We're doing a physician recruitment meeting. I've got a young doctor who might be selling in Mattawa, and I meet with him at 6. Will you still have quorum if I leave?
Yes, we will.
Okay.
Thank you, though, for
I
that.
apologize for that, and you have a great rest of the meeting, and have a great summer. We'll see you soon.
Good luck recruiting your physician.
We're bringing for a plane ride tonight.
Oh, good. Just don't make him jump out like Dr. Chirko's brother did yesterday.
Thank you.
Okay, thank you. And okay, I'll continue on with the vote. Jamie?
Yes. Just one
Okay.
question. Should we be
Yes.
done by about 6:15?
Yeah, oh, yeah. I don't think we'll be
Okay,
too long,
okay.
I hope. But we're not
Okay.
sure, but we'll try and move it along. It depends on how many questions we have.
Okay,
And we may
all
have a
right,
few.
Okay.
Okay. Dan?
Yes.
Marianne?
Yes.
And Tanya?
Yes.
Okay, with that, the motion is carried to move into camera. that the Board of Health rise and report at 6:10 p.m. Well, I guess it'd be 18:10 is what we go by this clock. All right, in favor? I'll call the vote. Dean? You left? Okay, left. Okay, Blair?
Yes.
Okay, and Nancy, yes. Jamie?
Yes.
Dan?
Yes.
Marianne?
Yes.
And Tanya?
Yes.
With that, it's carried. Thank you very much. And our last item is adjournment. And I guess we can do that, and we'll be able to get you out on time too, JB, okay? So wishing everybody a very happy and safe summer, and I hope we don't have to come back and do any kind of call out to you about anything else with our negotiations. The next thing you'll hear from us that everything went really well. So have a great summer, and we'll see you in the fall.
Great. Thank
Bye,
you.
everyone.
Thank
Everybody take
you.
care.
Yeah.
Thank you.